Madrigals are a dramatic trifecta in musical history. 1, they come about in the 1500s, not long after the printing press, and so we have many examples. 2, compared to older works like Gregorian chants or direct Italian predecessors like the Frottola, which were homophonic, madrigals borrow polyphony from the motet, but differ in their secular and non-Latin nature. Taking polyphony from north of the Alps and mixing it with Italian standards, these new sounds were so angelically divine that, just as how angels have no bodies and no need to breathe, the music would go on endlessly and required a nuanced development of polyphony and counterpoint to hide the necessary breaths. The Renin-Angiotensin-Aldosterone system, 3, is also a trifecta. We get questions about CKD stages and GFR cutoffs for medications all the time. We all remember hits like these. Years ago, they proved the benefits of ACE inhibition for slowing down nephropathy, especially in moderate CKD, as well as decreasing time to dialysis, transplant, and death. Here, the number needed to treat was 15. Though, after a later trial, it was thought that RAS discontinuation in advanced CKD would improve GFR, and everyone should hold their horses. But this trial only had 52 patients. So they decided to increase the N, increase the time, and see what would happen. In a big enough trial, are ACE inhibitors safe in advanced kidney disease? The Frottola comes from Italy and flourishes in the Mantuan courts with Isabella d'Este. It has up to 4 parts, usually a single voice with accompaniments, homophonic, isometric, and without counterpoint. The Frottola consists of a few well-defined phrases with long improvisations to make up for short texts that are often from Petrarch. There's frequent repetition because of rhyming lines, but that goes into the way that they're written, which is not for now. Simplicity, clear repeated sections, as well as avoidance of complex polyphonic devices are Frottola classics. They cannot be classified as folk songs, as they were sung by and for the aristocracy and the cultivated middle class. Frottolas contrast strongly with the imitative polyphony and multiple parts of the contemporary Flemish Burgundian compositions. These will later merge in a way to make the madrigal. The trial also has multiple parts in that it takes place in over 30 centers, and like the Frottola, confined to a specific country, in this case the United Kingdom. The trial focused on adults who are already CKD stage 4 and taken an ACE or an ARB without too many other comorbidities. Because the trial is looking at preventing ESRD leading to dialysis, it tried to make the exclusion criteria simple. Participants could not be on dialysis or have additional complications like hypertension or heart and stroke problems, because if you had a STEMI, you should stay on your ACE inhibitor. Before Italian influences mélanged with the Franco-Flemish to create the madrigal, you have something called a French chanson, folk stories set to music. These dabble with both polyphony and counterpoint, and you will note little moments of wandering phrases, which is a madrigal staple, its origin seen in both the Italian Frottola as well as the French chanson. Chansons differ from madrigals in that they were not based on text or poems, but were simple folk songs. However, like the madrigals, chansons were not sung in courts, but by normal people like you. Just as how the madrigal is the treatment of 2 traditions, French and Italian, our trial has 2 treatment groups, those who stop RAS meds and those who continue them. In both treatment groups, the people were allowed to be on any other guideline-directed medical therapy with a goal blood pressure to be under 140/85, no doubt affected by the Accord blood pressure trial. You will notice there are no SGLT2 inhibitors here because they started prepping this trial around 2014, before those were the big deal they are today. Though other trials, like the EMPA kidney trial, also released at this time, does show benefits, though not tested in people with such advanced renal disease. Follow-up was every 3 months for 36 months. If you remember the Frottola from before, then you'll remember that there was a one voice with accompaniments, and that voice was sort of a wandering voice, with notes going all over the place. As the French chanson meets the Italian frottola and the two mix and mingle, we have the beginning of a madrigal sound, some polyphony, and more of that wandering voice. An interesting outcome. The trial also has interesting outcomes. The primary outcome is the GFR at 3 years, as measured by variance of this equation, which we will get into in talking about the patient population. There were many secondary outcomes. End-stage renal disease and renal replacement therapy initiation were lumped together, a 50% decrease in GFR, and then things that indicated end of life, like death and hospice. You also had quality of life questionnaires, exercise capacity on 6-minute walk tests, among others. To contrast the polyphony we keep talking about is homophony, which Josquin de Prez El Grillo, or the cricket, displays. There's an identifiable melody where other voices are serving as the harmony. There is no counterpoint, though there is a little bit of that wandering voice. The patients are homophonic as well. Look how well they are matched. Patients were pretty evenly distributed according to age, greater and less than 65, GFR greater and less than 15, diabetes type 1 and type 2, weighted mean arterial pressure less than or greater than 100, and proteinuria with protein to creatinine ratios above and below 185. You'll notice the patients are mostly male, mostly white, so the GFR equation that includes race maybe shouldn't matter too much. Interestingly, most did not have diabetes. As it still does, music from the time mirrored life, and the Italian courts, now all fancy, felt that skill should be perfected but never shown off. This mirrors polyphony in the madrigal, as all parts blend together with none standing out braggadociously. Skills were to be perfected but never flaunted, much like voices. The origin of the madrigal's polyphonic sounds are in the Franco-Flemish traditions of the late 1400s. Johannes Ockeghem and Josquin de Prez, who wrote this here piece we're listening to, which is clearly polyphonic, spent their lives as court composers. As the sounds become more refined, we will see the evolution of what will become the madrigal. Our outcomes are also polyphonic, as there are primary and secondary outcomes. The primary outcome, GFR, was stratified within subgroups, and you can visually see that there was no statistically significant change between them. They used 3 different equations to calculate GFR, each with similar end results, namely that there was no big difference between the groups where one stopped and the other continued ACE inhibitors. The motet is a polyphonic religious text in Latin. It differs from the madrigal in that it is not in the common tongue of the country where it is composed, French in France, English in England, German in Germany, but in Latin. It is also a religious piece where the madrigal is more about day-to-day life. Motets also tend to be less peppy. The secondary endpoints were also less peppy. If you recall, we were looking at these things like time to ESRD or renal replacement therapy initiation. Although it was clinically significant, it was just shy of statistical significance. We also looked at cardiovascular events, which didn't show a great difference. Deaths were also similar, as were the blood pressure results and proteinuria. Musically, the Madrigal is polyphonic. Thematically, it is secular and not in Latin. And in writing, it is poetic and appropriate for the common man. It is a blend of a Franco-Flemish tradition of polyphony with the Italian traditions like the Frottola, with long improvisations and a wandering voice. What can we take away from it? It is a universal phenomenon in its appeal from the British Isles out to the Rhine and down to Iberia. The Stop ACEi trial has a similar broad scope. There was no improvement in GFR after stopping RAS inhibition in people with advanced CKD. Although not statistically significant, more people who stopped RAS inhibitors went into ESRD and required renal replacement therapy. Quality of life questionnaires as well as exercise capacity were the same. If you were on a RAS inhibitor for cardiovascular disease, proteinuria, or hypertension, they should not be stopped in the setting of low GFR. Things to point out, the study was not blinded, and the N of 400 was not powered enough to find significance in the secondary outcomes. This is something worth pointing out since future trials may want to recruit more people. You might say that the GFR measurement that takes race into account may skew things, which is not without merit. But since the subject were overwhelmingly white, it is less relevant. A primary outcome of time to renal replacement therapy may have been better since people tend to care more about having to start dialysis rather than their GFR number. The international phenomenon of the madrigal will dominate the musical world for well over a century, but all things must pass and transform as things and people change. Italy will once again lead the musical charge with the aria, characterized by solitary voice in an A-B pattern, and an accompaniment with either one instrument, or in the case of the opera, a whole orchestra. So how do things change now with the conclusion of the Stop ACEi trial? We saw that there were some underpowered results, so larger trials may be needed in the future. Additionally, SGLT2 inhibitors are going to start being used for proteinuria in mild CKD based on the EMPA kidney trial that came out this year. It stands to reason they will eventually be tested in advanced kidney disease as well. Although underpowered to adequately look at RAS discontinuation and cardiovascular events and mortality, since the study clearly shows no benefit in stopping it for the kidneys, it seems weird to stop it for the heart, and these two systems tend to always be linked.